Don't stop. Don't stop. Don't stop. Don't stop. Don't.
Dura Mater. Cranial nerves are 12 in number and originate from the brain and leave the cranial fossa via foramina to seek their targets. Most of the cranial nerves serve structures about the head and neck. However, the vagus nerve, in addition to serving structures in the head and neck, serves structures in the thorax and abdomen. The cranial nerves are named and numbered by convention with Roman numerals Ie.g, facial nerve, cranial nerve 7, where the Roman numeral 7 indicates the seventh cranial nerve. Sometimes the cranial nerve is given a CN designation, example CN7, but this is often left out as one learns that the Roman numerals are used only to number the cranial nerves. The CN designation will normally not be used in this textbook. Diploic veins are the veins located between the internal and external compact layers of the bony skull. These diploic veins are in communication with the veins of the scalp, the meningeal veins, the venous sinuses, and with each other. Dura mater is the outermost layer of the three meningeal coverings of the brain because it is housed in the cranial fossa. Dura is the thick, collagenous connective tissue layer covering the brain. However, it does not follow the contours of the brain. It consists of two layers, an outer, vascular periosteal layer in contact with the bony skull, and an inner meningeal layer that is in close contact with the arachnoid, the middle meningeal layer covering the brain. The periosteal layer covers the meningeal arteries and is closely adhered to the skull bones, especially at the bony sutures. Dural blood supply is provided by several meningeal arteries, namely, the anterior, middle, accessory, and posterior meningeal arteries. The anterior meningeal artery branches from a branch of the ophthalmic artery. The middle and accessory meningeal arteries originate from the maxillary artery, whereas the several posterior meningeal arteries arise from the ascending pharyngeal, occipital, and vertebral arteries. These meningeal arteries all arise from arterial vessels outside the cranial fossa and enter it via foramina to vascularize the meninges. Dural reflections are formed in the meningeal layer of the dura. These reflections are interposed between certain regions and subdivisions of the brain. For example, the falx cerebri is the dural reflection that is interposed between the right and left halves of the cerebrum. The falx cerebelli is the dural reflection that subdivides the cerebellar fossa into right and left halves. The tentorium cerebelli is the horizontal dural reflection that partially separates the cerebellum from the occipital region of the cerebral hemispheres, and the diaphragma sella is the dural reflection incompletely covering the sella turcica. Additionally, the sensory ganglion of the trigeminal nerve, cranial nerve V, is covered by a dural reflection. These dural reflections assist in protecting the brain. They also form a framework for the arteries, veins, and the dural sinuses. Dural venous sinuses receive venous blood from the meningeal veins, from large veins from the surface of the brain, from most of the named veins of the brain, and from the diploic of the skull. The venous sinuses are not vessels, rather, they are endothelial-lined spaces that collect the venous blood and deliver it to the bulb of the internal jugular vein. From there the blood exits the skull via the internal jugular vein. In addition to receiving venous contributions from several sources, the superior sagittal sinus also receives cerebral spinal fluid from the lacuna lateralis located on either side of the superior sagittal sinus. Emissary veins are veins that originate outside of the skull and find their way into cranial fossa to communicate with the dural venous sinuses. Although some of these emissary veins are small and inconstant, the fact that all emissary veins are without valves indicates that the blood flow through them is related to pressure. Thus, they could be passageways of infection from an extracranial to an intracranial direction. The cranial fossa, or the cavity inside the skull, is occupied by the brain and its associated meninges. This chapter discusses the dural lining, its venous sinuses, and cranial nerves that exit the skull. The osteologic characteristics of this region are presented in Chapter 6. The dura mater is the outermost layer of the three meninges covering the brain housed within the cranial fossa. It consists of two layers, a periosteel layer adhering and attaching tightly at bony sutures of the calvaria and a meningeal layer abutting the arachnoid, the middle meningeal layer. The brain is surrounded by three layers of meninges, a tough, fibrous outer dura mater and two delicate layers, the innermost pia mater and the middle, web-like arachnoid. The latter two layers are discussed further in chapter 17, whereas only the dura mater is described here. The dura is a thick, collagenous, coarse investment that does not follow the contours of the brain. It consists of two layers, the one in intimate contact with the bones of the skull is the periosteel layer and the other, in close contact with the arachnoid, is the meningeal layer. These two layers adhere closely to one another, except in regions occupied by veins and venous sinuses. The periosteel layer is vascular and is attached to the underlying bone via collagen fibers, known as Sharpie fibers. These attachments are particularly cranial base fracture. Hard blows to the head may cause hemorrhage in the middle meningeal arteries to collect between the calvaria and the dura, forming extradural or epidural hematomas. These events may produce a slight concussion, with recovery followed by drowsiness, perhaps followed by coma, as the mass of blood compresses the brain. The skull must be opened, the blood evacuated, and the ruptured vessels occluded. Cranial base fractures may rupture the internal carotid artery, producing an arteriovenous fistula, thus permitting blood flow into the cavernous sinus and from there retrograde flow into its tributaries. In this instance, the nerves coursing through the cavernous sinus, cranial nerves 3, 4, V1.Vt, and 6, may become affected. Cranial nerve 3 is affected first, with pulsating, protruding eyeballs and engorged conjunctiva. Notable at the suture lines, where the dura is firmly bound to the intrasuture materials. The periosteel layer of the dura covers the meningeal arteries, which groove the inner surface of the cranial vault. Dural reflections. The dura does not follow the contours of the brain except at certain areas where its reflections separate subdivisions of the brain, providing additional support and protection. One major dural reflection, the tentorium cerebelli, separates the cerebellum from the cerebrum. The other major dural reflection, the falx cerebri, separates the right and left halves of the cerebrum. Additionally, there are three minor dural reflections. The meningeal layer of the dura is folded in certain areas, forming incomplete subdivisions of the cranial cavity. These dural reflections are interposed between various parts of the brain, providing it with additional support and protection. The two major folds are the tentorium cerebelli and the falx cerebri, and the three minor folds are the falx cerebelli, the diaphragma sella, and the covering of the trigeminal cave. Tentorium cerebelli. The tentorium cerebelli is a horizontally positioned reflection of the meningeal dura that lies between the cerebellum, which it covers, and the occipital region of the cerebral hemispheres, which it supports. The anterior margin of the tentorium cerebelli is free and concave. It assists in the formation of an oval opening, the tentorial incisure, whose anterior extent is limited by the dorsum celli of the sphenoid bone. The attachments of the tentorium cerebelli, which fix this structure and make it taut, are as follows. Anteriorly, it is fixed to the anterior and posterior clinoid processes of the sphenoid bone. Laterally, it attaches to the superior edge of the petrous temporal bone. Posteriorly, it is fixed to the periosteel dura attached to the lips of the groove for the transverse sinus of the occipital bone, thus participating in the formation of that sinus. Falx cerebri. The falx cerebri is a sickle-shaped fold of the dura. Its inferior edge is free and forms an arc interposed between the two cerebral hemispheres, Fig 9-1. Anteriorly, the falx cerebri attaches to the crista galli of the ethmoid bone. Superiorly, it is fixed to the periosteel dura along the lips of the groove for the superior sagittal sinus, thus participating in the formation of that sinus. Posteriorly, the falx cerebri is attached to the periosteel dura of the occipital bone, assisting in the foriation of the inferior aspect of the superior sagittal sinus. Inferiorly it leans to the tentorium cerebelli. These two meningeal reflections of the dura, The tentorium cerebelli and the falx cerebri form the straight sinus at their line of intersection. The remainder of the inferior aspect of the falx cerebri is not attached, and this free inferior margin contains the inferior sagittal sinus. Falx cerebella. The falx cerebelli, a small meningeal reflection located deep to the tentorium cerebelli, subdivides the cerebellar fossa into right and left halves. It is attached to the inferior surface of the tentorium cerebelli and is interposed between the two cerebellar hemispheres. The attachments of the falx cerebelli are as follows: posteriorly, the periosteal dura of the region of the internal occipital crest, containing the occipital sinus. Superiorly, the inferior surface of the tentorium cerebelli. Its anterior edge is free, except at its anterior terminus, where it is attached on either side of the foramen magnum. Diaphragmocella. The diaphragmocella is an incomplete covering composed of meningeal dura that acts as a membranous cover over the sella turcica of the sphenoid bone. The sella turcica houses the pituitary gland. The diaphragmocella is perforated in the middle, permitting the infundibulum and accompanying vessels of the pituitary gland to pass through it. Covering of the trigeminal cave. The trigeminal ganglion sits on the periosteal, dural, lining in the trigeminal impression on the apex of the petrous portion of the temporal bone. The ganglion is covered by a meningeal reflection, thus transforming the depression into a cave, known as the Meckel cave, or the trigeminal cave. Blood supply of the Dura Mater. Several arteries supply the dura and the calvaria. The middle meningeal artery, a branch of the maxillary artery, is the major artery serving the dura. Smaller areas of the dura are served by branches of the ophthalmic artery anteriorly, whereas branches of the occipital and vertebral arteries serve the dura posteriorly. The dura mater receives its principal vascularization via the anterior, middle, accessory, and posterior meningeal arteries. It should be noted that these vessels also supply the calvaria. The anterior meningeal artery, derived from the anterior ethmoidal branch of the ophthalmic artery, serves the dura of the anterior cranial fossa. The middle meningeal artery, the largest of the meningeal vessels supplying the dura, is a branch of the mandibular, or first part, of the maxillary artery and enters the cranial cavity via the foramen spinaceum of the sphenoid bone. It grooves the lateral wall of the cranial cavity and divides into branches, forming an arboreal distribution. This vessel and its branches serve the dural lining of the parietal, sphenoid, temporal, and occipital bones. Some of its branches also vascularize the trigeminal ganglion and roots of the trigeminal nerve. The accessory meningeal artery, also a branch of the maxillary artery, gains entry to the cranial fossa through the foramen ovale to vascularize the dura of the trigeminal cave and the trigeminal ganglion. The posterior meningeal arteries, branches of the ascending pharyngeal and occipital arteries, enter the cranial fossa via the jugular foramen, hypoglossal canal, foramen lacerum, and mastoid foramen. An additional posterior meningeal artery arises from the vertebral artery after that vessel has passed through the foramen magnum. All of these small vessels supply the dura of the infratentorial space of the posterior cranial fossa. Venous drainage of the dura mater is by the anterior, posterior, and middle meningeal veins, which have distribution similar to their corresponding arteries. The anterior meningeal vein empties into dural sinuses of the anterior cranial fossa, the posterior meningeal veins empty into the posterior dural venous sinuses, and the middle meningeal vein delivers its blood into the sphenoparietal sinus and the pterygoid venous plexus. Venous sinuses of the dura. Do and the Blund spaces, i.e. the FD to TH Edbor, which receive venous blood from emissary veins, the brain, and diploic of the calvaria. They are interconnected and the blood in them eventually reaches the internal jugular vein, which drains blood from the cranial fossa. The dural venous sinuses are large spaces in comparison to their slender venous tributaries, such as the emissary veins and those that drain the brain and the diplo of the skull. Because the sinuses are endothelially lined spaces between reflections of taut dura mater, their walls are rigid and possess no valves. The sinuses deliver their blood either directly or indirectly via other dural venous sinuses to the superior bulb of the internal jugular vein situated in the jugular foramen. The dural sinuses are named superior sagittal, inferior sagittal, straight, occipital, confluence of sinuses, transverse, petrosquamous, sigmoid, cavernous, intercavernous, sphenoparietal, superior petrosal, inferior petrosal, and basilar. The superior sagittal sinus, located in the superior aspect of the falx cerebri, begins as a narrow channel just anterior to the crista galli at the foramen cecum, where it may receive a small emissary vein from the nasal cavity. This sinus receives several of the superior cerebral, dural, diploic, and emissary veins, as well as communications from the lacunae lateralis, situated on either side of the superior sagittal sinus, which leaves a depression in the parietal bone. The superior sagittal sinus enlarges in diameter as it passes posteriorly toward its termination to empty into the right transverse sinus. The inferior sagittal sinus occupies the free, inferior margin of the falx cerebri and, draining posteriorly, empties into the straight sinus along with the great cerebral vein. The straight sinus occupies the line of intersection between the falx cerebri and tentorium cerebelli. It receives the great cerebral vein, the superior cerebellar veins, and the inferior sagittal sinus and delivers its blood to the left transverse sinus. Occasionally, the superior sagittal sinus empties into the left transverse sinus and the straight sinus then terminates in the right transverse sinus. The occipital sinus lies in the space between the periosteal and meningeal dura of the falx cerebelli and empties into the confluence of sinuses. The confluence of sinuses is a region receiving several of the sinuses into the large dilated space at the internal occipital protuberance. The superior sagittal, straight, and occipital sinuses empty into the confluence, which is then drained the right and left transverse sinuses. The transverse sinus occupies the dural space at the attached perimeter of the tentorium cerebelli. The sinus of the right side usually receives blood from the superior sagittal sinus, whereas the one on the left usually drains the straight sinus. The petrosquamous sinus is located at the fusion of the temporal squama and its petros portion. This sinus, the superior petrosal sinus, as well as the diploic, emissary, inferior cerebral, and inferior cerebellar veins also empty into the transverse sinus. The transverse sinus continues anteriorly as the sigmoid sinus, which grooves the temporal, parietal, and occipital bones and empties into the superior jugular bulb of the internal jugular vein. The cavernous sinus, a labyrinthine space covered by the meningeal layer of the Dura Mater, is positioned against the body of the sphenoid bone just lateral to the sella turcica. This sinus receives blood from the orbit via the inferior and superior ophthalmic veins, from the pterygoid plexus of veins via emissary veins, and from the brain 7 cerebral veins. The sphenoparietal and intercavernous sinuses also empty into the cavernous sinus. This large sinus is drained by the superior and inferior petrosal sinuses, delivering the blood to the superior jugular bulb of the internal jugular vein. Two structures pass through the cavernous sinus, each separately isolated from the bloodstream by endothelially lined fibrous sheaths, the internal carotid artery and the abducent nerve. In addition, several cranial nerves are embedded in the lateral wall of the cavernous sinus, from superior to inferior, the oculomotor and trochlear nerves and the ophthalmic and maxillary divisions of the trigeminal nerve. The two intercavernous sinuses are termed the anterior and posterior intercavernous sinuses, passing anterior and posterior to the infundibulum, respectively. These connect the right and left cavernous sinuses, thus forming a ring-shaped circular sinus. The sphenoparietal sinus is a small sinus passing along the infero-posterior ridge of the lesser wing of the sphenoid bone. It receives small venous contributions from the surrounding dura and empties into the cavernous sinus. The superior petrosal sinus assists in draining the cavernous sinus and empties into the transverse sinus. It passes along the superior border of the petros portion of the temporal bone. Along its course, it also receives cerebellar, inferior cerebral, and tympanic veins. The inferior petrosal sinus also drains the cavernous sinus and empties directly into the superior jugular bulb. It travels in the inferior petrosal sulcus, a depression created at the juncture of the occipital clivus and petrous temporal bones. The internal auditory veins, cerebellar veins, and smaller veins of the brainstem join the inferior petrosal sinus. The basilar plexus interconnects the two inferior petrosal sinuses. The plexus lies on the basilar portion of the occipital bone and receives blood from the vertebral plexus of veins. Diploic veins. The diploic is the cancellous bone containing red bone marrow located between the internal and external tables of compact bone of the calvarium. Veins within the diploic are called diploic veins, and they communicate with meningeal veins and veins of the scalp. They drain into the dural sinuses. The diploic veins are located between the two compact layers of bone that form the vault of the skull. They travel in the diplo and, in adults, communicate with each other, the meningeal veins, veins of the scalp, and the dural sinuses. There are 4 diploic veins. The frontal diploic vein drains into the superior sagittal sinus. The anterior temporal diploic vein serves mostly the frontal bone, emptying into the sphenoparietal sinus. The posterior temporal diploic vein is responsible for draining the parietal diploic and emptying into the transverse sinus, and the occipital diploic vein serves the occipital bone, delivering blood to the confluence of sinuses directly or to the transverse sinus. Emissary veins. Emissary veins originate outside the skull, then enter the skull through foramina, where they communicate with other veins and empty into the dural venous sinuses. Emissary veins do not possess valves, thus, blood flow is directed by pressure, which may serve as a passageway for infections from outside to inside the skull. The emissary veins, as their collective name implies, serve to connect the veins of the external aspect of the skull with the dural venous sinuses. Although some emissary veins are small and, as such, inconstant, many are significant. It should be noted that because these vessels do not possess valves, blood flow through them responds to pressures within the system. Consequently, they are possible passageways of infection from an extracranial to intracranial direction. The major emissary veins are those described as follows. The mastoid emissary vein links the occipital vein with the transverse sinus via the mastoid foramen. The parietal emissary vein interconnects the veins draining the scalp with the superior sagittal sinus by way of the parietal foramen. The deep cervical veins are united with the transverse sinus by the condyloid emissary vein, which passes through the condyloid foramen. The venous drainage of the nasal cavity is connected with the superior sagittal sinus via the emissary vein of the foramen cecum. The internal jugular vein is interlinked with the cavernous sinus via the emissary veins of the carotid canal and the foramen of vas ileus. The pterygoid plexus of veins is united WLTH the cavernous sinus via the emissary veins of the foramen lacerum and foramen ovale. The vertebra 1 vein is connected to the transverse sinus by emissary veins of the hypoglossal canal. The 12 cranial nerves emanating from the brain leave the cranial cavity via foramina in the cranial fossa. During removal of the brain from the cranial cavity, the connections between the brain and the cranial nerves are severed, and these detached nerves may be observed on the floor of the internal base of the skull. Meningeal nerves. Meningeal nerves are the sensory nerves to the dura. They are supplied mostly from all 3 divisions of the trigeminal nerve, cranial nerve V. Parts of the posterior cranial fossa and roof are supplied with meningeal branches arising from the vagus, cranial nerve X, and hypoglossal nerves, cranial nerve 12, with contributions from upper cervical spinal nerves. Sensory fibers that supply the dura are called meningeal nerves and are provided mostly by all 3 divisions of the trigeminal nerve, cranial nerve V. Additionally, dura of the roof and floor of the posterior cranial fossa are supplied with meningeal branches from the vagus, cranial nerve X, and hypoglossal, cranial nerve 12, nerves and, possibly, meningeal fibers of spinal nerve C2 and C3. It is interesting to note that whereas most of the meningeal fibers arise from the cranial nerves while in the cranial fossa, some arise outside the cranial vault and recur back into the cranial fossa via foramina to provide sensation to the dura. The anterior, rostral, most nerve structure is the olfactory tract and bulb, lying just lateral to the crista galli on the cribriform plate of the ethmoid bone. The olfactory nerve, the first cranial nerve, Ie, passes through the perforations of the cribriform plate to enter the bulb as numerous tiny filaments emerging from the olfactory mucosa of the nasal cavity. The optic nerve, the second cranial nerve, II, passes through the optic foramen from the retina of the eye. It continues at the optic chiasma, which rests on the chiasmatic groove of the sphenoid bone just anterior to the infundibulum of the hypophysis. The oculomotor nerve, the third cranial nerve, III, passes through the dura in the vicinity of the cavernous sinus on its way to the orbit via the superior orbital fissure. The trochlear nerve, the fourth cranial nerve, IV, the smallest of the cranial nerves, courses along the free margin of the tentorium cerebelli. It pierces the dura at the posterior clinoid process to pass forward in the lateral wall of the cavernous sinus, eventually to traverse the superior orbital fissure on its way to the orbit. The trigeminal nerve, the fifth cranial nerve, V, the largest of the cranial nerves composed of two roots, is evident just inferior and posterior to the small trochlear nerve. The roots enter the trigeminal cave deep to the dural cover, where the sensory portion displays its sensory ganglion, whereas the motor portion passes deep to that structure. The trigeminal, semilunar, ganglion trifurcates into ophthalmic, cranial nerve V, maxillary, cranial nerve V2L and mandibular divisions, cranial nerve V, which leave the cranial cavity via the superior orbital fissure, the foramen rotundum, and the foramen ovale, respectively. The motor root accompanies the mandibular division and, subsequent to passing through the foramen ovale, merges with it. The abducent nerve, the sixth cranial nerve, 6, is noted piercing the dura medial and inferior to the root of the trigeminal nerve. It passes through the cavernous sinus to exit the cranial vault and enter the orbit via the superior orbital fissure. The two roots of the facial nerve, the seventh cranial nerve, 7, and the vestibulocochlear nerve, the eighth cranial nerve, 8, accompany each other into the internal acoustic meatus, under the canopy of the tentorium cerebelli. The glossopharyngeal nerve, the ninth cranial nerve, 9, the vagus nerve, the 10th cranial nerve, X, and the accessory nerve, the 11th cranial nerve, 11, all leave the cranial cavity via the jugular foramen. The accessory nerve is composed of a spinal portion ascending through the foramen magnum and a cranial portion with which it unites in the cranial cavity before exiting the cranial vault through the jugular foramen. The most caudal cranial nerve, the hypoglossal nerve, the 12th cranial nerve, 12, exits the internal base of the skull via the hypoglossal foramen. The cranial nerves and their distributions are discussed in chapters relevant to their locations.